Intravenous therapy means that we are using a catheter in the vein to deliver typically fluid. So we know that in a hospital, for example, a lot of folks are familiar with saline. And saline is essentially salt water that matches the body's normal fluid parameters, unless we're delivering medications, which can be done in the hospital setting. There is also a lot of use for intravenous vitamins, etc. We know, for example, that if people have really heavy metal toxicity, it is documented that you can use what's called chelation therapy. Chelation means to bond or bind, and so we can use certain therapeutics to bind those heavy metals once you've tested and demonstrated there's a definite need for that. We do chelation therapy here for our patients as it is appropriate. There is also the ability to support the body by giving vitamins and minerals, antioxidants such as glutathione. You can also use amino acid therapy. Each one of those therapies have a different reason that you would employ those to try to support somebody's normal function, and that really should be done with your physician. That needs to be done on a case-by-case basis because not each person should be using the same type of therapy. The other thing to understand is that the doses widely vary. Now that we have so many different people asking about IV therapy, there isn't a cookie cutter approach, which is why you really want to work with your doctor who knows your whole case in order to use IV therapy. So the reason that we use it here with our patients is because we're working with each individual patient to support their system and what's going on for them. And that's what I encourage anybody watching this to do, is make sure you're working with your physician. Because a lot of times now people will just come in off the street to some of these clinics that have just popped up and they go, oh, we do IV therapy, but there isn't anybody who knows that patient and knows that case to be able to make sure that that's what's actually happening and what's actually best for that patient.